we find that actually the microdose, so some people like at Silicon Valley and whatnot, or it's this trendy thing to do microdosing, especially out there on the West Coast. But that people
well,
say they're
we
more.
know what they're like.
Those West Coast hippies. No,
Yeah.
they say it makes them more creative, but actually studies show that that's not necessarily the case. Actually, when you do these microdoses, you don't get that creative effect. But at the slightly higher doses, where you do get a kind of psychedelic effect, an out-of-body experience. So part of it is, well, each drug is different. Part of it, let's say with the psilocybin or the mushrooms, we think that some of the effect has to do with the dissolution of the ego. So when you dissolve the ego.
That's a charged phrase, and I'd love to get a little bit more clarity on that.
So kind of our ego is like our sense of self. But when we look at where that is kind of instantiated in the brain, there are certain parts of the prefrontal cortex, back to the prefrontal cortex, that kind of encode our sense of self. And one in particular is a part I mentioned before, the dorsolateral prefrontal cortex, which is like our sense of agency and also like our inner critic. So when we ruminate and we have anxiety, you actually get increased activation of parts of the prefrontal cortex. So like with impulse control problems, you have decreased activation in that parts of the prefrontal cortex. With compulsive or anxiety, you have overactivation. So that rumination and going in circles and you can't stop. And the inner critic, oh, what do people think of me? How am I doing? But if you turn that part of the brain down.
At this very moment, you are pointing to your temples. Is that roughly correct? And that's important for people who don't cotton to the long words like dorsolateral cortex and such.
Yeah.
But that's very, very important. It sounds like those are real discoveries.
Yeah. And so it's kind of like the part of your brain that is the filter system that filters your behavior to make sure you're conforming to social norms and whatnot. So one thing, obviously there's the anecdotal, like suddenly these patients where we've tried everything, nothing works, and suddenly they have these profound shifts that are long lasting. And so the next question is, well, what's the underlying brain mechanism, right? Because with the psychiatric medication, you have to constantly be on it for it to work, right? Every day you wake up, you take your, whatever it is, your serotonin agonist, and as soon as it wears off the next morning, you got to take another one, right? It has to stay in your system for it to have the effect. Whereas this, you do it one or two times and something changes and suddenly, the anxiety is gone or the depression is much better. And so what is it? And so we have some hypotheses. Well, one thing we know is that, let's say the psilocybin tends to affect this dorsolateral prefrontal cortex, which is, related to our sense of self. And when it's turned down, you kind of lose your sense of self. You feel interconnected. You get that sense of like oneness with everything, something larger than yourself. And all these like little individual problems and the ruminations kind of dissipate. And that's almost similar to like when people are in these flow states or certain meditative states where you lose your sense of self and you feel is associated with very positive emotions. And there might just be some sort of, because of this interconnectivity, like some sort of psychic shift in a way that is long lasting, that is permanent. And so like, let's say, for example, the fear of death, which is actually, if you dig deep enough, is the sort of underlying a lot of our anxieties, right? Like, why are you afraid of, let's say, contamination type OCD, like afraid of germs? Well, it's because I'm going to get some bad disease and I'm going to die. And death is like the ultimate fear. Or why are you afraid of spiders? Because spiders can be poisonous and bite me and I'm going to die. So if you take away that deep-seated underlying fear to much of our anxiety, which is death, and if you can remove that, then it's sort of like a domino effect and all these other things can fade away. Or like with depression, a lot of the rumination, it's the idea is that your default mode or your kind of basic mode that your brain is in where you're not engaged in a specific task is, if your default mode is rumination, like whenever you just think of yourself, you're ruminating. But this psychedelic experience can almost break that cycle or break the kind of strongholds that these negative emotions have over your executive function system, let's say, that it can just have a profound shift. That's with the psychedelics. With the MDMA, it might be slightly different. With the MDMA, it's that you might be in a very comfortable state when you're on it. and that it allows you to bring up these uncomfortable memories that normally provoke a very negative like emotion. So you can't even tolerate it. You have to suppress it. But in this case, it allows you to bring it up in a neutral or in a positive environment and in a way like reintegrate it into your brain so you can have the memory, but it doesn't have to be associated with the horrible trauma like you experienced, like reliving the events, right? A lot of people
softening it, right?
Exactly. So in a way, you still say, okay, yes, that happened to me, but it's not going to trigger all these horrible emotions. And so it's almost like breaking that cycle and using the drug.
Spiral, right?
Exactly. They actually take the drug and have the experience with the therapist present. So it's not like, because some people are like, oh, I just go to the club and, do the MDMA and then I'll see my therapist the next day and I'll be fine. No, it's actually a very prescribed, it's a trained therapist who you go in a room and might be an 8-hour session where you are sitting with the therapist and they are guiding you through the experience. And it's a way to actually uncover things that might be suppressed for a very long time. This is, let's say, with the MDMA and PTSD, because like I said, each one has a slightly different effect. But and the same thing with the psilocybin, the therapist is there. So it's therapeutic, it's psychedelic assisted psychotherapy. So you're doing the psychotherapy while you're being assisted by the drug. And then you take that information you got during the sort of drug induced session, and then you can then carry that out forward to other sessions where you don't need the drug anymore. So now you can work on those issues that came up in that other setting. So there's a lot of pieces to this, and we're still trying to figure out why it has such an impactful effect. But I think part of the effect, it's not necessarily the drug itself, which is like with the serotonin, you need it every day. It's the psychic effect somehow, the actual experience, the psychological experience, rather than changing your neurochemistry. It's allowing you to have a certain psychedelic experience or have a certain perspective, a perspective shift. I liken it to those astronauts that have an overview effect. They see the Earth from above, from far away, and it eventually shifts their whole perspective, right? And that kind of shift in perspective that these drugs allow, just you can have that experience with you. So again, it's not about the psychopharmacology per se, like the traditional psychedelic drugs. It's about the experience. And that's why those microdoses don't necessarily have the kind of impact, because you actually need the psychic effect. So there's been some research with the psilocybin looking at kind of mapping out brain connectivity and using also something called MEG, which is a neuroimaging technique as well. But what you see is greater signal diversity across the brain. So if you think about it, if you're like trying to map out connectivity, you see a lot of like local connections in the brain, right? And some long range connections in terms of like communication pathways, let's say, or like if you have a bunch of roads in the brain, like which are the ones that are the most heavily trafficked, right? And they tend to be more local ones with a couple of long range ones, but they're filtered, because if your brain was communicating every place all the time, it would be sort of chaotic, right? You need some filtering so things make sense and they're logical. But on psilocybin, we see there's sort of like an opening of the filter. So you get a lot more traction across a whole variety of different connections. So there's sort of more dialogue between different parts of the brain.